Goeiedag! Good day, fellow South Africans and citizens of the world. And you know what? One thing about that deep state, they're very, very clever. And when it comes to the coronavirus, they're finding another way to actually bring slave labor into reality in the world under this new world order that they're planning. And we talked about that earlier, last night, with Joel. And if you have a look at my videos, just a couple back, you'll see the live stream with Joel where he talks about this very point about how the coronavirus is now being used by the deep state to basically corner people, to actually put them into lockdown and just get them used to the concept of being in lockdown, which allows them to do all sorts of nefarious things which are not good for our civil liberties. And one of the areas that's really concerning is this one. It's about the Gates Foundation. Fauci, who's the top doctor working with Trump, or he goes on the press, meet the press type situations with Trump. Fauci, mandatory coronavirus immunity cards are under consideration. You get that? Mandatory. You have to have it. Here's what they're planning. A national health ID. This has been under development by international agencies along with Gates Foundation for several years. Planning for this has been done by ID 2020, which I covered a couple of months back. An organization supported by Accenture, the Rockefeller Foundation, Microsoft Corp, and others. Of note, among the others, is Gavi, the Vaccine Alliance, whose support of ID 2020 demonstrates the interest of would-be global population managers in tying vaccination to identification. A first step towards implementing this goal is conditioning people, get this, conditioning people to accept the idea that they will need to prove their vaccination and health status before being allowed by government to engage in any activities that heretofore were exercised without restriction by a free people. To that end, Dr. Anthony Fauci, the head of the National Institute of Allergy and Infectious Diseases, or NIAID, and key member of the Trump administration's coronavirus task force, admitted that the federal government is considering forcing citizens to use coronavirus immunity cards. You know that's possible, Fauci told CNN. I mean, it's only one of the things that we talked about when we want to make sure that we know who the vulnerable people are and who are not. He continued, this is something that's been discussed. I think it might actually have some merit under certain circumstances. The idea was also floated by Bill Gates, former head of Microsoft and current international supporter of digital ID schemes tied to vaccination. During an Ask Me Anything session on the social media site Reddit, Gates said he supported using immunity IDs. Eventually, we will have some digital certificates to show who has recovered or been tested recently, or when we have a vaccine, who has received it, Gates said. The constellation of efforts Gates has been making around digital identity and vaccination includes funding research at MIT on encoding health and identity data into a quantum dot-based system that can be embedded in the skin. Incredible. Described by researchers in the journal Science Translation Medicine, the researchers said they had developed an approach to encode medical history on a patient using the spatial distribution of biocompatible near-infrared quantum dots, or NIRQDs, in the dermis. QDs are invisible to the naked eye, yet detectable when exposed to NIR light. The journal translates this into less technical terminology. McHugh et al. Developed dissolvable microneedles that deliver patterns of near-infrared light-emitting microparticles to the skin. Particle patterns are invisible to the eye, but can be imaged using modified smartphones. By co-delivering a vaccine, the pattern of particles in the skin could serve as an one-person vaccination record. These results demonstrate proof of concept for intradermal on-person vaccination record keeping. Records in scientific journal research databases reveal sources of funding for studies like this one. In this case, funding was provided by the Bill and Melinda Gates Foundation, along with the National Science Foundation, the National Cancer Institute, and the National Institute of Health here in the United States. Funding sources also include the Youth Innovation Promotion Association of the Chinese Academy of Sciences, the China Scholarship Council, and the National Natural Science Foundation of China. Fauci and the NIAID have a history of working with the Gates Foundation on worldwide vaccination programs. In 2010, the World Health Organization launched the Global Vaccine Plan to guide discovery, development, and delivery of life-saving vaccines. The World Health Organization, or WHO, UNICEF, and the National Institute of Allergy and Infectious Diseases, or NIAID, and the Bill and Melinda Gates Foundation have announced a collaboration to increase coordination across the international vaccine community and create a global vaccine action plan, said the World Health Organization press release announcing the plan. It continued, the collaboration follows the January 2010 call by Bill and Melinda Gates for the next 10 years to be the decade of vaccines. Hear that? Decade of vaccines. The Global Vaccine Action Plan will enable greater coordination across all stakeholder groups, national governments, multilateral organizations, civil society, the private sector, and philanthropic organizations, and will identify critical policy resources and other gaps that must be addressed to realize the life-saving potential of vaccines. The Leadership Council for this initiative included Margaret Chan, Director General of the World Health Organization, Anthony Fauci, Director of NIAID, part of the National Institutes of Health, Anthony Lake, Executive Director of UNICEF, Joy Fumafi, Chair of the International Advisory Committee and Executive Secretary, Adrian Leaders Malaria Alliance, Tachi Yamada, President of Global Health at the Bill and Melinda Gates Foundation. Among these names, readers of the New American may be familiar with Anthony Lake, who previously served as National Security Advisor to President Bill Clinton. Lake, who had been nominated by Clinton to head the Central Intelligence Agency, infamously wasn't sure if notorious Soviet spy Alga Hiss was actually a spy. Now, it's interesting. We're talking about Clinton wanting to put this fella Lake as head of the CIA. When I was speaking to Joel last night, he said the CIA, the FBI, the NSA, all these secret organizations which are supposed to be working for the people in the US are actually working for the deep state. They've been totally infiltrated. In its documentation, the Global Vaccine Action Plan called the numerous steps, including the use of ID technologies, to track those vaccinated. According to the Global Vaccine Action Plan 2011 to 2020, summary available as a PDF from the World Health Organization, it states, reaching every community will call for an understanding of the barriers to access the use of immunization. It will also require the understanding to be identified and microplans at the district and community levels to be reviewed and revised in order to ensure that these barriers can be overcome. The rapid expansion of informal technology should be leveraged to establish immunization registries and electronic databases that will allow each individual's immunization status to be tracked, timely reminders to be sent when immunization is due, and data to be accessed easily to inform actions. The introduction of unique identification numbers could be a catalyst for the establishment of such systems. So there you go, the mark of the beast, the mark of the Gates Foundation. As if tracking and controlling people isn't bad enough, there may be more sinister population control plans afoot. Speaking at a TED conference in 2010 on the subject of cutting carbon emissions to prevent global warming, Bill Gates pointed to population control as one area where an impact can be made. Among other things, he singled out vaccination as having a role in population control. First, we've got population, Gates began. The world today has 6.8 billion people. That's headed up to about 9 billion. Now, if we do a really good job on new vaccines, healthcare, reproductive health services, we could lower that by perhaps 10 to 15%. Now, most people make the reasonable conclusion that vaccines are making people less prone to disease and therefore healthier, promote population stability, if not outright growth. But Gates, quite curiously, tied vaccines to population control in this talk. Subsequently, Melinda Gates has attempted to explain his counterintuitive philosophy on vaccines for population control. In the couple's 2017 annual letter, she wrote, "Saving children's lives is a goal that launched our global work. It's an end in itself. But then we have learned it has all these other benefits as well. If parents believe their children will survive, and if they have the power to time and space their pregnancies, they choose to have fewer children." Credible, but also creditably disputed claims, including in Kenya, that some Gates-related vaccines intervened in human reproduction. Aside, Gates and his organization are interested in population control. Their work for a decade or more on tying vaccination to identification is clearly part of this agenda. Even taking the generous position of assigning to Gates the possibility that he is attempting to simply improve childhood health and reduce poverty does not negate concerns about using vaccination and health IDs to track the world's population. After all, such a scheme creates a system of control for population technocrats to direct the lives of billions of people in a power grab of unimaginable proportions and consequences. At least not everyone in the Trump administration is simply going along with the internationalist plan for the implementation of health IDs. Speaking to Laura Ingraham on Fox News, Attorney General Bill Barr said he didn't like the idea of vaccine IDs and certificates to prove immunity to COVID-19. He said, "I'm very concerned about the slippery slope in terms of continuing encroachments on personal liberty. I do think during the emergency, appropriate, reasonable steps are fine." Asked for more specifics, he continued, "I'd be a little bit concerned about that, the tracking of people and so forth generally, especially going forward over a long period of time." Opposition aside, if technocrats such as Gates achieve their aims, Americans will not be able to shop, work, travel, or do anything else without their vaccine health ID, which will almost certainly end up in some sort of technological and possibly injectable form. This likely would then be combined in the future with your credit score and other social scores, becoming an all-encompassing tracking and management technology for the world's population. Now, they've actually got social scoring already happening in China. And that's if you go against the Chinese autocracy, their beliefs and their policies, you get hammered. And as your social score comes down, you have rights taken away from you, including things like travel, only a credit card, all those sort of things. As your score goes down, those things get taken away from you. This is happening right now in China. Okay, guys, please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video. Please share this video. And above all, please stay safe.